Assalamu alaikum warahmatullahi wabarakatuh. My article for this week is articaine infiltration of the mandibular lateral incisor. Is it volume or location of the infiltration that affects sexes? This study, which was done by Dr. Smithson, Allreader, and others, and was published in the JOE in 2023. The article discusses the challenges faced by dental professionals in achieving profound anesthesia for teeth in the mandible. The traditional method of using lidocaine to block the inferior effluent nerve is often ineffective, especially for a mandibular lateral incisor. Alternative approaches such as labial infiltration or combined labial and lingual filtration have been studied, but their success rate have been limited. So the aim of this prospective randomized crossover study was to determine the anesthetic efficacy of a labial infiltration of 3.6 ml volume of 4% articaine with 1 to 100,000 epinephrine compared to labial infiltration 1.8 ml plus lingual filtration 1.8 ml of 4% articaine with 1 to 100,000 epinephrine and the mandibular lateral incisor. Moving to materials and method. 100 subjects randomly received 2 sets of injections using 4% articaine with 1 to 100,000 epinephrine consisting of labial and lingual filtrations of 1.8 ml and 2 labial infiltrations of 1.8 ml of the mandibular lateral incisor into separate appointments. For inclusion criteria, the ages of 18 and 60 and categorized as a class 1 or 2 of American Society of Anesthesiologists. For exclusion criteria included pregnancy, allergy to articaine, history of depression, having taken CNS depressed like alcohol, pain medications within 24 hours, or inability to provide full and willing consent to participate. ABT was then used every 3 minutes for 60 minutes, starting at 1 minute to check the level of bulbal anesthesia. The bulbal anesthesia was considered successful when the 80 ABT reading was achieved. Anesthetic failure was defined as no 80 readings with the ABT. Following the completion of each appointment, the subject completed a post-operative pain survey. The survey consisted of 4 days of feedback, starting with the day of infiltrations when anesthesia wore off. The data were analyzed statistically. Moving to the result, the labial and lingual combination exhibited a significantly higher anesthetic success rate, 97%, when compared to the 2 labial infiltration, 74%, and had significantly higher 80 reading from 1 minute to 58 minutes. The highest success rate was 97% at 16 minutes for the labial plus lingual infiltration, whereas the 74% success rate with the 2 labial infiltrations had a slower onset at 22 minutes. So the conclusion from this study, a combination labial plus lingual infiltration using a 3.6 ml volume of 4% articaine with 1 to 100,000 epinephrine significantly increased bulbal anesthetic success for the mandibular lateral incisor when compared to a labial infiltration using 3.6 ml volume of articaine. Therefore, the location of the infiltrations was more important than a volume.